Today, new numbers from the state show flu cases more than tripled. Last week, 900 tests came back positive. Earlier this month, that number was closer to 150. WRAL's Chelsea Donovan joins us now live after speaking with a pharmacist about what these numbers mean for his work. Chelsea?
Deborah, after more than 2 years of being suppressed, the flu is back with a vengeance in our state. It was suppressed due to those COVID-19 measures, and now we're seeing a surge of cases here in our state. This, as doctors and pharmacists say, there's also a surge of patients coming in to get those flu shots.
Flu shots are in high demand at Health Park Pharmacy in Raleigh.
We've had a huge influx of individual patients, but also employers that have asked us to come on site.
So I made sure to roll up my sleeve and get one, as doctors we talked to say now is the time.
This year, to see people in early October with influenza is pretty unusual for us.
Raleigh physician Dr. Jim Parsons has had more than a dozen calls in the past week of his patients down with the flu. He believes the flu is spiking due to less social distancing and masking at a minimum.
Probably everybody's antibodies are down.
The CDC says seasonal flu vaccines are safe and effective. During the 2019-2020 flu season, flu vaccines prevented an estimated 7.5 million flu illnesses, 105,000 hospitalizations, and 63,000 flu deaths across the U.S. Antivirals like Tamiflu have been gathering dust on pharmacy shelves for the last 2 years, while the flu largely disappeared during the COVID-19 pandemic. But now pharmacists in the Triangle say they are in high demand, some wholesalers even out.
All of our preferred products for the generic are unavailable currently. There are some, but the price point is much higher.
I asked the state if they expect a Tamiflu shortage due to the early flu season spike, and they said, quote, currently North Carolina Department of Health and Human Services is not aware of a statewide Tamiflu shortage impacting North Carolina. There is always a chance for local inventory shortages around this time of year, but we have not been informed of any at this time.
As of last week, flu cases make up just about 3% of emergency room visits in our state. Deborah?
Chelsea Donovan reporting live in Raleigh. Thank you, Chelsea.